daily rounds. So I talked about our evaluation process. I'm going to talk a little bit about daily rounds. We have a daily rounds for cats as well as dogs, where we have a team of people who walk through the shelter and evaluate every pet on a daily basis. I'm going to show you a document. So this is the daily rounds form that we use for dogs. We also have a daily rounds form for cats, but it's a little different from this one. For dogs, for the first 3 days in the shelter, we evaluate them for all the categories that you see up there. Appetite, where there's urine or feces in the cage. We do our daily rounds at about 9:15, so after the dogs have been out to playgroup or for a walk if they don't go to playgroup. So ideally their cage should be clean and free of any elimination. So that's answered as a yes or no in terms of whether that occurs. We offer the dog a treat. Does the dog eat a treat? If the dog doesn't eat a treat, so we have treat buckets outside our cage. I'll show a video of that later. If the dog doesn't eat a treat, we'll offer them a special treat, like a piece of hot dog or a super yummy treat to see if this dog is stressed because he's not eating, would he eat something special? And then we score them, similar to the cat evaluation, on a 0 to 3 scale for friendliness, fearfulness, aggression, jumping, barking, circling, and destructive behavior. So if there's no fear, you'll see that the space is left blank. If the dog is hiding in the back of his cage and not coming forward, the dog would get a 3 on fear. And then we also have an other category. And then we also have a note section. So this dog was coughing a lot, so we had a note about that to let our veterinarian know. Obviously, I'm a veterinarian too, but I deal with the behavior side of things, and our shelter medicine team deals with the medicine side of things. So we record the observation for the first 3 days of a dog's stay. We used to record it every single day that the dog was with us. But what we found, and we haven't done the research yet to confirm this, but after the dog has been with us about 3 days, we're family to them. So initially we're the stranger walking by. They don't know us. If they're a dog with fear issues, they oftentimes have problems with us. After 3 days of us walking by and tossing treats, they get to know us and they get very comfortable with us. So we found that after 3 days, we were getting, this is the friendliest dog in the world, no aggression, it's a perfect dog. So we found that the most useful information was in the first 3 days. So we record the information for the first 3 days. After those first 3 days, we still do rounds, and we still think about all those things as we're looking at the dog, but we don't record it unless the dog has a significant change. So if now all of a sudden the dog is behaving aggressively, I am going to record it. All right. Population management, I talked about managing the entire population versus the individual. For us, it's a way of maintaining a balance of easy versus more challenging pets. And when I say more challenging, I'm talking about pets that are more challenging to find an appropriate owner and home for, but these are pets that once they're in the home, these should be pets that people love and are happy with and are not challenging for them. Because that is not our goal, to place very, very challenging pets into homes. As I said, we're known as the shelter that takes behavior problems, so we have shelters from all over our area asking us to take dogs with problems and cats with problems. And what we found is that we had a shelter full of dogs with problems and more cats with problems than were easy to find homes for. And what we were concerned about was going to happen over time is if every time a customer came into the shelter looking for a dog, we had challenging, we might be known to the public as the place that if you want a healthy dog for a family, you can't find one at the Animal Rescue League of Boston. So we have a commitment to maintain a balance of easier animals, so animals with less than 3 points, versus more challenging pets, so that we can maintain that balance of easy versus more challenging. And also very, very important, probably for me, the number one reason I wanted to start this fast track program for us was that the behavioral cases for dogs take a lot of our resources, and we only have 21 dog cages in our shelter, but if all 21 of those dogs had behavior problems, there's no way we can provide adequate welfare for them. So it's also acknowledging our capacity. We don't have the capacity to handle 21 behavior problems, so we've created a balance of easier so that it doesn't take as much of our resources. Daily rounds, very important for me because it may decrease length of stay, and that if I'm assessing and evaluating this dog or this cat on a daily basis and looking for changes, looking for reasons why has this cat not been moved up to adoption yet, the more attention I pay to that, we're going to have a decreased at-risk period, because the quicker that cat or dog moves through the shelter, they're less at risk for getting diseases the quicker we get them out. And we're going to have an increased number of adoptions per time period. Remembering that decreased length of stay, so decreased length of time in the shelter, does not mean increased euthanasia. And when the UC Davis team has been looking at this in terms of their data, they're certainly finding that that's not true at all. We're being more efficient, we're being better at what we do so that we move them through the shelter more quickly.